thing where you have one microphone and you plug them all into the one little box?
No, we need sky hooks, and just hang them on here. Introduce my favorite congressman and the next governor of the state of Missouri, Mr. Kenny Hulshof. So,
thank you very much. Wow, short and sweet. Appreciate that.
Let's get down to the good stuff.
It's a little warm in here. For whoever wrote the blog that said last week that, you know, I talked about putting out a health care proposal in short order. Yes, we knew that today was coming. In fact, this has been something, let me just as a backdrop, you know, we've talked about this for a long time. We've talked about generalities of health care, but more importantly, what can we do specifically to deal with those that are uninsured in the state of Missouri? You know, we face a lot of challenges. David, you were with me on the Missouri business tour. Some of you, I mean, basically around the state of Missouri, listening to what the state has done well for business, what are the challenges for business, consistently, in addition to things like workforce development and having folks that are ready to take jobs. One of the things we heard consistently across the board from both workers and from business owners is the cost of health insurance. And what are we going to do in the state of Missouri? Now, there's been a lot of discussion about which direction we should go. I don't think we should hit the reset button. You know, I don't think that putting everyone back on the government rolls to a failed system, not only was that bad health care for Missouri's most vulnerable, but for taxpayers it was unaffordable. And so we've put together a plan. We've looked at plans all across the country, and we've seen what has worked. We've seen things that perhaps haven't been as productive as some of the states thought, and we have put together a plan, a Healthy Missouri Access Exchange, Health Max, which I think is a bold, innovative idea that addresses all of the challenges here in our state. We have about 700,000, again, you all have reported this, and so I adopt the number, and I think it's fairly consistent, 700,000 Missourians that don't have health insurance, and as a result, they're vulnerable. They're vulnerable to illness because they don't have access through insurance to quality care. They're vulnerable to enormous cost, especially, for instance, when you talk about the ultimate fee-for-service. If you don't have health insurance and yet you have to have a procedure that's done, Jerry, that's your... That's you, buddy.
I didn't do it.
Oh, there you go.
I wasn't even in the room when it happened.
When you have a procedure and you are right out of pocket, I mean, that's an enormous expense then that has to be borne by vulnerable Missourians. And so these challenges really require innovative solutions. And again, hitting the rewind button to go back to the 20th century is not the answer. The answers to the problems of tomorrow require a lot more creativity than simply reinstating hundreds of thousands of Missourians to the Medicaid rolls. And so the way that we do this with Health Max is to rely upon market forces that provide efficiency, maximum access, and reasonable cost. Health Max is a new marketplace that's designed to increase access to affordable health care for all Missourians. It'll be affordable not just for the consumers of health care, but for taxpayers in our state. Consumers will enjoy the benefits of multiple plans. They'll have choice. This is voluntary. There are no government mandates in Health Max at all. Again, this has been some of the criticism. I'll throw out the state of Massachusetts. The Massachusetts plan that has a so-called connector, and yet there are mandates that go along with that Massachusetts plan. This one does not. We afford Health Max through a combination of cost sharing. Again, this is something that as we are subsidizing, for instance, health savings accounts for those that don't qualify for Medicaid, we ask them to share a small part as far as a co-payment, and so they can take ownership of their own health insurance. We're going to look at dish payments, disproportionate share payments, only instead of doing them at the back end, we're going to bring them up to the front end. We'd like to utilize Missouri Foundations for Health to make sure that it encompasses its intended purpose, and that is dealing with the uninsured. And more importantly, Health Max is going to be accessible. Here are just some of the specifics. I'm trying to anticipate some of the questions that you're going to have, and certainly we'll ask for follow-up. One of the differences, one of the key differences between this and any other plan, this is not Insure Missouri, this is not really anything else that has been proposed in the state. One of the reasons is that coverage plans within Health Max will not be allowed to discriminate against anyone. In other words, if you have a pre-existing condition, the health plan, if you want to participate as a private insurer in the Health Max plan, you cannot discriminate. Now, the obvious question then you might ask would be, well, how in the world, if you, because right now this exclusionary risk pool, you bid out these plans because you take those that have a pre-existing condition and you try to use that pool. We bring everyone into the pool. In fact, we roll the 60,000 state employees into the pool. They will be allowed to opt out of Health Max. Again, this is completely voluntary on their score. But instead of an exclusionary risk pool, we're going to have an inclusionary risk pool. And certainly then, for those folks that make too much to qualify for Medicaid, yes, we provide a subsidy for a health savings account, and they too then, as this is about 200,000 people in the population, they too will be included within the risk pool. And so this is a way that we get around this age-old discussion about adverse selection, is that we expand the risk pool, but if you're an insurer and you want to participate in the plan, you cannot exclude coverage for anyone because they have some pre-existing medical condition. And this is bold, and it's innovative, and it, I think, addresses many of the challenges that we have. One other key component, and then I'll open it up for questions, is portability. Simply, layperson's term, of course, we are a very transient workforce. The number of jobs that we have, especially for those that are entering college now, over the course of their professional careers, they'll probably take half a dozen or more jobs. And so making sure that they have the chance or the ability to take their health insurance with them as they move from job to job is a key component to this plan that, again, I believe sets it apart from any other initiatives. Finally, one of the largest sectors of workers that don't have insurance are those who work for small businesses. And boy, there have been a lot of ideas about what do we do for those employees of small businesses. We are trying to help small business owners, and I am one, to get out of the healthcare business. And I can see a small business owner, for instance, designating Health Max as the insurer of choice and providing perhaps a defined contribution to his work or his worker for them to purchase health insurance within Health Max. Again, this is a way that goes way beyond just the vulnerable population that everyone seems to be focused on. And we're taking this to all Missourians would have the opportunity to look at the competitive model that we're putting forward as far as providing health insurance. There are a number of other related issues that I think probably are in your packets. Let me just, the things that we can actually do to champion better outcomes and health, and those are smoking cessation, electronic records. It would be, the ideal situation would be that every Missourian has his or her own individual medical record. We do need to have better transparency on price and quality. Again, we have to be better consumers of health care, and so making that information available as customers or consumers of health care are important. One thing that I think everyone in this race for governor agree with is that we have to help Missourians that are in need. Health Max does that and much more. We can help the most vulnerable Missourians. We can also make health coverage more affordable for everyone. We're taking into account Missouri's most vulnerable as well as the taxpayer. That's why I think it's been a long time coming. We worked very hard. Give credit to Jay Barnes and others as far as the policy. And by the way, in anticipation of this, we've